and we were all shocked. We didn't know what to do. That time there was no linear accelerator even in Coimbatore. There was no cancer center in Tirupur. And we are middle-aged, middle income group, not poor, but still we could not do that because we have to take her to Chennai, take a house because she required radiotherapy and she required chemotherapy, and we have to keep somebody along with my mother. So it was very difficult. That time only we thought we should start a cancer center in Tirupur. So the lesson what we learned in this is never treat your own relatives, kith and kin. And even if you treat, do proper examination, investigation. Don't assume and presume. If only we would have done the first day itself, we could have detected. But luckily for us, the mother was operated. She lived more than 20 years after the operation. The irony of the story is the person, a lady doctor who is my close friend, who operated my mother, she died after 3 months because of colonic cancer. That was a very sad thing, you know. She saved my mother. In fact, my mother was very happy and she gave a necklace to her. We went to her house and gave necklace and said, "You saved my mother." But within 3 months, she died of colonic cancer. Ladies and gentlemen, that is why I thought cancer care center is a must, and even in a small town, because every house there is a cancer. That is why, with all your blessings and with all the support, I have initiated this project of 100 crores of cancer care hospital in Tirupur for all the poor people. Now, even the middle income people, they can have the cancer treatment in Tirupur. Otherwise, just imagine a person from Tirupur has to go to Coimbatore or Chennai. They have to take a house. They can take a house, they can take the treatment, but who will stay with the patient? That is a very, very big issue. If it is a local, at least we can have the radiotherapy and come back home. So this is one lesson. Now coming to the second one, a 52-year-old obese individual, a diabetic, had sudden left-sided chest pain. That was the time, 1978, I just opened the ICU. And the patient came with chest pain, typical chest pain. So I was very, very happy that I have a case. So the patient is also rich. I admitted him in ICU, did all the tests. That time there was no troponin. So we did SGOT, everything we did. ECG we took, no problem. Second day I took ECG, no problem. Everything is normal. Third day, that patient developed eruptions. Then it turned out to be herpes. So in herpes, even pre-eruptic phase, people have severe chest pain, especially left-sided chest pain. You suspect because he's got a risk factor, obesity, diabetes, and left-sided chest pain. Then it turned out to be, then I felt so ashamed, you know. I told him to kept him in ICU first day, because that was the time I opened the ICU. So the first case which I took, you know, I really felt so bad. From that time onwards, if somebody has chest pain, I also think, okay, maybe if the ECG is normal, I think about the third case. There is one Shanmugha Sundaram, who is an exporter. He was one of the 7 exporters in Tirupur who started along with my brother. Very rich person, and he came to me with typical symptoms of ischemia. I admitted him. I took a first ECG. ECG was normal. Then second ECG after 24 hours I took, again ECG was normal. But immediately the patient said, "Sir, ECG is normal, let me go home. I am all right. Why should I be in the hospital?" But I had a doubt because it was strong history and typical history. Luckily for me, his wife and children, they went to US. Nobody at home. I said, "Nobody at home, so why do you want to go home? You please stay back in our hospital under my care. Let me take another ECG after 24 hours. Then I took a ECG after 52 hours. That ECG turned up to ischemia. So I was so happy. So believe in myself, the history, the science. So that's how sometimes you have to believe in you and then continue ECG, take the ECG, tell them, you can err the wrong side. You should not miss a ischemia. Rather, you take 2 days ECG, no problem at all. So that's why, that's the second case. And another person, my servant maid, a 56 years old lady, she has had diabetes neuropathy. And my wife gave her first injection, second injection also she gave, no problem. Third injection also was no problem. Fourth injection we gave when she was at home working, because it's a convenience, no? So we gave beyond B6, B12 injection. Believe me, after the injection she developed anaphylaxis. I was shocked, panicked. I didn't know what to do, because my own housemate. Then I was in Rayapeta living. So I took her to Rayapeta hospital, admitted her, and then we could revive her. Thank God. Then I told my wife and told everyone, never give any injection. Lakshman will agree with me. Even if you are giving an injection, your own kith and kin or your servant, have everything in hand, adrenaline, decadron, whatever it is. Otherwise, try to avoid giving injections. B1, B6, B12, 3 injections were given. 4th injection, I developed this problem. Thank God I was near to the Rayapeta hospital, rushed and then saved her. Then another lady, 45-year-old lady, a diabetic, who always says this is symptom, that symptom, dyspeptic symptoms, esophageal reflux, all that she was saying. One midnight, she called me, said, sir, I have a epigastric discomfort. Always the patients will relate story. Selvaraj also will agree. He'll say, this lady said, I had a big dinner in the marriage, and after that, when I came home, when I lie down, I have some discomfort in the epigastric region. Then I said, don't worry, every time this lady used to have the functional overlay. I said, take PPI and then come tomorrow morning. She came tomorrow morning, I took ECG, it's a frank infarct. So, functional, not always functional. You should, suspect, whenever you suspect, take ECG. This lesson, everyone should know. Don't ignore somebody says chest pain. There is a big cardiologist by name Paul Wood. Most of you know Paul Wood. Paul Wood has written a book on cardiology. But he himself had chest pain. He thought it is esophagitis and dyspepsia, and he died. So, a man who has written a book on cardiology died because of the ischemia, because he could not diagnose. So, don't, whenever patient says something, listen to him, then take ECG, even if you take 100 times. Then another lady, she's a